Hello, my name is Kai Nicholas, and I am here to invite you to join my new clinic called Kai Counseling. Now, here at Kai Counseling, what we specialize in is female therapy theory. What is that, you might ask? Let me go ahead and tell you. So, a little bit about myself. Again, my name is Kai Nicholas. I am pursuing my LPC, and what brought me to feminist therapy is my love and passion for women in maternal health care. So, what I want to do is further assist not only women but men as well with their mental health using the feminist therapy theory. So a little bit about feminist therapy. So at this time, the theory discusses the innate natures of gender roles and how they play out in society. Now, when females are born, they are born to be nurturing and caring, and because of the cultural labels that are placed on women at birth, this plays a major role in their development. So, the theory believes in the lifespan perspective, which assumes that during human development, personality and behaviors can change at any time rather than during early childhood. So, things like a woman's appearance at this time is based on how men find women attractive, and women's roles are based on the need of a man. Women are said to be subordinate to men at this time. So at my clinic, we're here to dispel a lot of those theories. And because of these cultural problems, women become depressed, and at times they develop eating disorders based on their development. Now, women are able to relate to one another and are able to share their understanding of the male culture in order to survive. Men, however, do not need to understand women in order to survive. Women are living in a sexist reality and have developed women's intuition in order to assist them moving forward in society. Now, a little bit about the therapeutic relationship between myself and my clients. So, using the feminist theory, the relationship between counselor and patient is defined as egalitarian. So what that means is I will consider us to be equals. I don't want there to be a reason why I should have more power than you. I don't want to give any reason to add to your oppression. So at this time, therapists strive to keep things, again, as equal as possible by discussing their values with the client during our initial intake session. I also want to discuss, again, any power struggle that we might have. So I'm going to do my best to keep you in the know when it comes to your diagnosis and your treatment. And I also encourage you to provide your own perspectives when appropriate and strive to break the conventional barriers of that counselor-patient dynamic. So again, about the therapeutic process, the goal for feminist theory is to empower my clients and assist them with recognizing their personal power as well. Feminist practitioners such as myself work to help their clients value and affirm diversity, as well as work towards change, equality, and balancing both your independence and your interdependence as well. So a few techniques and interventions that I plan on using with my clients would be, number one, I'm going to go ahead and use the empowerment technique. That again is to uplift and motivate my clients as much as possible. Now, because women do believe that they are living in a life of oppression, using the DSM-5 is not something that we typically do at this time. So I believe that gender, culture, and race play a factor when assessing my client's symptoms, and due to this, it is very difficult to come to a concrete diagnosis or assessment. Also, I believe that diagnoses are based on what dominant cultures believe to be normal and show minimal account for other cultures. So I really choose not to use labels as much as the other clients may want to, in order to, again, minimize depression and oppression. So I'm going to put more emphasis on individual change and progress with no regard to societal change. So again, back to my techniques. What I want to do is use our empowerment strategy. I want to also use the self-disclosure technique, which is done to continue empowering my clients, as well as equalizing the client-therapist relationship and help clients establish some informed consent. Lastly, I want to use the gender role analysis technique, and this technique helps clients discuss how their gender roles influence their values and behaviors. In addition to the gender role analysis technique, which discusses how social gender roles influence values and behaviors, I also want to discuss that men are also included in feminist therapy as both patients as well as practitioners. They own their own male privilege and confront sexist behaviors in themselves and others. Female practitioners work with males to help create a safe climate, to reflect on past pain and changes for the future, as well as allowing men to see what shaped them. Moving forward, I want to discuss 2 articles that prove the effectiveness of the feminist therapy approach. The first article is going to be about the inclusion of men in feminist therapy. Actually, both articles are going to be about that. So the purpose of the first study was to gain further insight on the perceptions and experiences of male feminist therapists. So this study was done with 12 white male psychologists from all over the world. So the results did indicate that men who self-identify as feminist clinicians report using feminist techniques, such as attending to the socio-cultural context, emphasizing the social construct of gender, and minimizing therapist-client power differentials in their work. And the second article, also about males in feminist therapy, the purpose of this article was to show whether or not men provide the acceptance of positive attitudes toward feminism and the women's movement and liberal gender role attitudes by male therapists were related to their use of feminist therapy and behaviors and techniques. So the results did indicate that male feminist therapists endorse attitudes and practices consistent with the values and principles of feminist therapy, and attitudes toward feminism and the women's movement and liberal gender role attitudes correlate positively with feminist therapeutic approach. Lastly, the results indicated that feminist male therapists approach their work with women clients differently than self-identified non-feminist male therapists. So the authors were able to conclude that men could practice feminist therapy and that male feminist therapists can serve as effective therapists who empower women clients, and women perspectives. And in the other article, the authors did conclude that that female teachers and mentors for the development of non-sexist practice among male therapists were beneficial to the therapy practice. So in conclusion, I do want to advise that feminist therapy is not only beneficial for women, but it's also beneficial for men as far as clients as well as additional practitioners. We do want to support limiting the oppression and increasing being advocates for diversity and uplifting and empowering all of our clients through the use of feminist therapy theory. So I hope to see you at Kai's Counseling Clinic and that we can schedule you an appointment. We look forward to seeing you soon. You have a great day.